Okay, we're going to try this again. My name is Ali Schmitz-Contreras, and I'm going to be presenting milk expression and storage. A lot of different things to discuss. So, why do we express milk? So, a general definition is we express milk for many reasons. Sometimes the baby is in the NICU, sometimes they don't latch properly, the parent has to work, and they're not able to stay home and breast or chest feed. The parent has chosen to pump exclusively, and the parent is having trouble breastfeeding and needing a break. I've known quite a few of my clients who decide to pump exclusively, and so this is also one of the reasons why I wanted to present this. And we can express milk in a number of ways. You can use hand expression, the manual pump, or the haka is very popular, the electric pump, and then also the ladybugs for milk collection, and the supplemental nursing system, or the SNS. So first I want to talk about hand expression. As a guide, you're going to always wash your hands and practice hand hygiene first. You're going to want to get comfortable and try to relax. You can place a warm towel on your breast if you want to at first, or the chest, and then you can actually massage to help stimulate just for a few minutes, and then it'll help the milk flow. Then you want to support the breast, and with your other hand, place the thumb and index finger on your nipple. And then using the C shape, you're going to gently press and gently pressing, and that's going to help empty all the ducts, which is super important, especially when baby is just born and you're wanting to really get that first bit of colostrum out. And if you don't get a super lot out in the beginning, it's completely okay. Your baby is getting enough. Next, I want to talk about the manual pump. If this is your first manual breast pump or haka, you may be wondering how the heck to use it. The haka is a silicone breast pump, and then there is also the handle breast pumps where you can basically it looks exactly like the electric pump with the flange, but it has a handle on it and you can squeeze. And then with the haka, you can actually squeeze so that it suctions to the breast. And then when you let it go, the milk actually just flows directly into the haka. And then, of course, you can always transfer it to a bottle or a storage bag. I think that manual pumping or the haka is actually a great way for milk collection, but it's also a really great way to maintain your supply. And I think it has a better suction than the electric pumps, but I've used both. I wanted to talk about the importance of flange size. So this is something that I didn't know as a doula and a birth worker, and I've been a mom for 11 years. So the flange size is actually incredibly important, and you want to make sure that you measure your nipple, not the entire areola. Make sure do not include the areola in your measurements, and you're going to want to add like 1 to 4 millimeter to your nipple measurement to get the flange size, and the exact amount usually kind of varies. But you want to make sure, just like in the picture that I posted there, that your entire nipple is more or less not entirely inside the flange, but at least almost halfway to the middle of it. If you have the wrong flange size, it can actually irritate the nipple, and it'll not get a good suction. So the electric pump will have it'll be working too hard, and it can irritate and actually make your nipples bleed. So flange size is incredibly important and something to consider always when you're getting an electric breast pump. And the breast pumps, there are many different choices. If you have Medicaid, your insurance, or you Medicaid, or you have private insurance, it most definitely usually covers a free breast pump. So that's always something to look into as soon as you find out that you're pregnant, making sure that you can find the right breast pump for you. And the basic steps out to using your breast pump are assembling your flange, and then it should be fitted on to the nipple, but not painful. And the tunnel should be 3 to 4 millimeters larger than your nipple, just like before with the flange size. So keeping in mind that it's always, the right size, center, and press gently, make a good seal. And then I really liked this, so I put it in there. Think about your baby to stimulate your letdown when you're pumping. Um, you can even have your baby nearby, and then making sure to turn the pump on low is one of the things that I find very important as well. Um, don't start off the pump going to the most extreme intensity. It can actually also cause nipple irritation, and it can actually cause you to have too much of a letdown, and you could overproduce, and it can cause engorgement. So starting out with a low intensity and then moving up gradually is more recommended. And I'm going to talk about the supplemental nursing system. It's a method of nursing your baby while supplementing the breast, and it's wonderful if your baby is born premature. Always keep in mind that this is not a long-term solution. Usually, babies, especially premature, develop the muscle coordination and strength and tend to successfully latch on their own. But it's also wonderful to consider for a while, especially if you're having issues producing and you want to still stimulate the breast. The SNS is a great way to do that. I'm going to talk about milk storage. So milk storage is really important, and following the directions from the CDC guidelines. I did not know how incredibly important it was until I actually got my doula certification. So the factors include the milk volume, the room temperature, and when the milk is expressed, the temperature fluctuations in the refrigerator and freezer, and the cleanliness of the environment. And these are the actual CDC guideline worksheets about pumping and expressing milk. Human milk is okay directly pumped on the countertop for 4 hours, and it can actually be refrigerated up to 4 days. And you can actually freeze it for 6 months, but it's acceptable to freeze it up to 12 months. So you can actually freeze it up to a year. Remember always to never refreeze human milk, and especially after it's been thawed. And the reason for that is because there's a lot of bacteria that can grow when you've already thawed the milk and then you refreeze it. This is the last worksheet. So you've got your storage. Make sure to label your milk and date it. That's going to be really important, especially when you're putting it in the freezer and you look in 6 months later and you're wondering, oh, did I ever use that bag? Thawing out, always make sure to thaw out your oldest milk first. That way you have it in the front of the rest of your batches and you don't have any risk of giving the baby old milk and that bacteria that is grown. Make sure to feed or serve your human milk at room temperature. It does not need to be heated. At most, if you really want to, once the milk is thawed, you can run it under a lukewarm tap so that the milk is not freezing cold when you give it to baby. Also very important to always remember to wash and clean once you disassemble. So wrapping up, there are so many wonderful ways to express breast and chest milk. There is no one way to do it, as long as a baby is getting the nutrients they need to help and develop and grow. Making sure to read and understand storage guidelines. No matter where you are, baby is getting all they need. You are an amazing parent and you've got this.